Hi, my name is Kenitra Brown Mayfield, and I am a medical provider in New Orleans, Louisiana. Today, I am coming to you to talk about something very, very important, and that is vaginal health. So, although I'm talking about vaginal health, this video is for both males and females because this is very important to both of us. I'm going to talk about what's healthy and what's not healthy, and this is going to be the first in a series of videos. So today we're going to talk about one of the most common problems. So let's start with the first part, which is going to be, and you may see me looking down at my notes because I want to make sure that I talk to you about every issue and I don't miss anything. So what we're going to discuss first is the normal healthy vagina. The normal healthy vagina includes a vaginal flora. So our vaginal flora is just like the rest of our body. From head to toe, we have a natural, it's a human biome, it's a microbiome, and it has bacteria, and those bacteria, they're healthy bacteria. And what they do is they fight away bad bacteria, and they just keep our body healthy. So the vagina has a normal flora, and in that normal flora is a normal bacteria. And in order to keep that normal flora and those good bacteria healthy and happy, our vagina has to remain within a certain pH. And that is about 3.5 to 4.5. And that is a slightly acidic pH. So, if you've heard of, the pH balance, and you have acidic and then you have alkaline. So with your vagina, you want the vagina to remain acidic. This is very important because when I start talking about the most common issue that most vaginas have, it has to do with the pH. So this is why I'm talking about the normal pH of the vagina. So the second thing about the normal vagina and a normal healthy vagina is vaginal discharge. Vaginal discharge, unfortunately, gets a bad name because a lot of people, they look at discharge and think that something is wrong. Now, our vaginas are self-cleaning, so they produce a liquid so that it can flush away bad bacteria and old skin cells. So you're supposed to have vaginal discharge. It has different functions. Some of it is for lubricant. Some of it is so it can move the sperm to where it needs to go. So at different times of a menstrual cycle, whether you're ovulating or you're closer to your period, you may have different types of discharge. You may have thicker at times. You may have thinner at times. It may be stretchy. It may be really thin and milky, or it just depends on where you are in your cycle and where you're having that discharge. Now, there's times where that discharge can be unhealthy, and we'll talk about that. But if your discharge does not have an odor, and if it changes throughout the month, that is normal. Now, if you're on birth control, you may not see all of those changes in your discharge. So someone getting off of birth control may be surprised by these different changes, but that is part of a normal, healthy vagina. So the second part is we're going to go back to pH. So pH is very, very important. Like I said, in order to keep your vagina happy, you have to remain in that acidic state. So anything that pushes your body or your vagina out of that acidic state into an alkaline state is going to cause a disruption of your normal flora, which can cause a bunch of problems. So I have a list here of things that can actually change your pH. So the first one is medications. Medications like antibiotics, that's one of the most common things that will change the pH of your vagina. Oral contraceptive pills, they change your estrogen levels. They can change your pH in your vagina. Health conditions like diabetes. Diabetes can change your pH with because of the sugar in your blood content. That can change the pH of your vagina. Tampon usage. So our periods, the blood in our periods is alkaline. It's I think it's about 8 or 9 on the scale of pH. And if you use tampons, what you're doing is you're keeping that blood inside of your vagina. And so after your period, that can cause a disruption of your pH. And that's why a lot of people sometimes they'll have a yeast infection or a bacterial vaginosis that occurs after their after their menstrual cycles. Third, and this is one of the most important ones. This is the one where most people get it wrong. Overwashing will cause a change in your pH. So douching is a no-no. Douching will completely, it's you using basic solution, alkaline solution, and what it does is it washes away everything that you need to have there. Soaps. So very harsh soaps or even mild soaps, because what happens is the ingredient in the soap that helps the soap to lather has an alkaline base. And so if you're overwashing, that will cause a change in your pH. So you don't want to overwash. Bubble baths will also cause an issue, and body washes as well. Another thing that changes your pH is vaginal infections, which we're going to talk about later. And lastly, your sexual partner. Now, this can be if you have new sexual partners, if you have multiple sexual partners, or if you have the same one monogamous sexual partner, they can change your pH. The reason why, again, is because our vaginal pH is 3.5 to 4.5, right? Well, the man's semen, his pH is about 7, so it's alkaline. And so that alkaline semen, if he ejaculates inside of you, it has the possibility of changing your vaginal pH. Also, if you have multiple partners, that can also change the vaginal pH by introducing new bacteria into your vagina. So that is the first part about healthy vaginas. Now, the second part is what I really want to get into, because it's the most common cause of vaginal issues that I see every day in practice. It's what I hear about. It's the questions I hear about. And this is important to men as well, because the most common thing that I hear from men concerning their partners or past partners are fishy odor. And so this is really important, because bacterial vaginosis, that is the most common cause of vaginitis in most women. And it happens in most women who are sexually active. And it can happen in those who are not sexually active, but it's usually caused in those that are sexually active. So let's go back to the causes of bacterial vaginosis. The number one cause of bacterial vaginosis is a change in the pH, or a disruption of the vaginal flora. And like I said, one of the biggest causes of that is overwashing, douching. Please stop douching. Please stop overwashing your vaginas, because what's happening is you're washing all the good bacteria away. And what's happening is now you have an opportunistic bacteria, Gardnerella, which causes most of the bacterial vaginosis. And that is now growing. And that's what's causing the fishy odor. That's what's giving people the discharge. So they're getting a white to gray, milky to thin discharge that has a fishy odor. And some people will also have some vaginal irritation, whether it's itching, maybe have some burning, but most of the symptoms are due to the vaginal discharge and the odor. So the common causes besides the soaps and the douching is the sexual partner, like I said, with the pH of 7. And now, you have a pH of 3.5 to 4.5, and their alkaline pHs can cause you to have a bacterial vaginosis. Your diet, having an increase, a diet with a lot of carbs, a lot of sugars, those things are going to cause an increase in your pH. And so the symptoms, again, like I mentioned, is going to be your fishy odor, your white to grayish discharge. But I want to go on and kind of give you some ideas of how to prevent this. So I have a list here of how we're going to prevent bacterial vaginosis. And this is very important, guys, because for you guys, I really want you to kind of, if you're watching this for your wife or your girlfriend, this is things that you can do to help them. So the first one is decreasing sugar, decreasing the sodas and the juices. That can make a difference, especially if you're finding yourself having bacterial vaginosis infections very often. And the second one, like I keep going back and forth to, because to me it's the most important, is stop over cleaning. So one of my suggestions is to use a pH balanced body wash. If you are really obsessed with cleaning your vagina, then you can use a pH body wash. I prefer one specific body wash. It was created by a lady who kept having bacterial vaginosis, so she made her own body wash. It's an all natural body wash, and it keeps the pH balanced, and you can use it. You can use it daily, Or if you want to just use mild soap like Dove, you can use maybe the pH balance body wash after your period or after sex to make sure, especially those people who like to douche, you can maybe replace the douching with a pH balance body wash that is specifically for your vagina. Probiotics are really good. So what happens is anytime somebody takes like antibiotics or anything like that, like I said, you get rid of all of your good bacteria. And so probiotics are promoting the good bacteria to grow on our microbiome and in our natural flora so that it can fight away the bad bacteria. So specifically for vaginal health, you want to get a probiotic that has a lactobacillus strand. And that's going to help to prevent and fight against the Gardnerella bacteria. Using condoms with new partners is one way to help to prevent you from getting bacterial vaginosis. So if you have a new partner, that's one thing you want to, and that's going to help prevent against other STDs as well, right? Avoiding hot tubs. Let's see. Overuse. Do not overuse antibiotics, and that goes along with the probiotics as I was speaking about earlier. We do not need an antibiotic for everything, and so when you overuse antibiotics all the time, if you feel like you always have a cold or a sinus infection, you always want to take the antibiotics, those things are washing away all of your good bacteria. So please do not overuse the antibiotics. Lastly, this goes back to the males. Once you're having sex with your partner, if your partner ejaculates in you, it's important that you urinate after sex. That's for two reasons. That's going to help prevent you from getting a urinary tract infection, and it's going to also prevent you. It's also going to help prevent you from getting a vaginal infection. Because what happens is there's two things, not just the semen. There's also the act of intercourse. You're taking the bad bacteria and you're bringing it up towards the inside and giving you, just exposing you to the outside bacteria. Speaking of that, I did not write that down, but I do want to mention, just as a woman is supposed to wipe front to back with sex, you need to make sure that you keep sex front to back. Do not go back and then go back to front, because that's another cause of bacterial vaginosis, because you're taking that back bacteria and you're bringing it towards the front. So that is very, very important. And so now I want to talk about treatment. So those are the things that will help you prevent you from getting bacterial vaginosis. But treating bacterial vaginosis, we can do a few things. We can do the medication-wise, you can do Flagyl, which is a pill, and you can use metronidazole gel, which is you insert into your vagina, and both of those are prescribed by your doctor. There's some natural treatments that if you want to try at home before you go to your doctor, and you can do Greek yogurt, just making sure that it is free of sugar, of any added sugars, and you want to make sure that it has both live cultures in there. Hold on, I wrote something down specifically about that. I wanted to mention it. It's you want to make sure it has like 1 million. I'm sorry about that, y'all, but it's live cultures. You want to make sure the yogurt has live cultures in there. Probiotics that will help to treat it naturally, but not the oral probiotics that will take longer to help treat it. It may take like 2 weeks to treat it. If you can find the probiotic suppositories, that can help to treat your bacterial vaginosis. Garlic supplements can help to treat it. One of my favorites for treatment is using essential oils and coconut oils and apple cider vinegar. So apple cider vinegar, you can put a cup of apple cider vinegar in your tub and sit in the tub for 20 minutes. You can do that every night for about 3 to 5 days, and that can help to get rid of the bacterial vaginosis. And the melaleuca, which is a tea tree oil, you can use that along with coconut oil. Never use it alone because it's very strong. You can take it with a few drops of melaleuca and about probably a tablespoon of coconut oil, and you can dip a tampon in that and soak it, and then you can insert it in your vagina and leave it for a couple of hours. Sometimes that would help. And those are just your natural treatments that you can try before you can get to your doctor. So that is the first issue that I wanted to discuss today, and that is bacterial vaginosis, and that is the first in our series of vaginal health. So guys, when your friends talk about that fishy odor, it's not always a problem. It doesn't mean the lady is dirty. It may mean that she may be cleaning herself too much, or she has done something that may have disrupted her natural vaginal flora. If you guys have any questions about bacterial vaginosis, just leave it under the video and I will try to get back to you. And stay tuned for the second session where I will discuss, I believe I'm going to talk about vaginal odors or maybe yeast infections. But stay tuned. You guys have a great day.